All right, welcome to The Explainer. Today we're talking about a condition that affects millions of people but is honestly pretty misunderstood. I'm talking about chronic obstructive pulmonary disease, or what most people just call COPD. Let's get right into it. Now, take a look at this quote. It's from a Vietnamese health source, and what it says is just so powerful. It basically translates to COPD progresses silently, so the patient doesn't even notice. And that right there is the whole problem. It's why people call it an invisible killer. It doesn't show up one day with a big announcement. Nope. It just creeps in, year after year, quietly making it harder and harder to breathe. And you really can't underestimate how serious this is. Look at this number. Worldwide, COPD is the third leading cause of death. Think about that for a second. That's higher than a lot of diseases that get way more attention. It's just a staggering fact, and it really shows you what we're dealing with here. So that leads to the big question, right? What is this silent disease? We've heard the name, we know it's a huge deal, but what's actually going on inside the body? What's happening to the lungs? Let's get into the nitty-gritty. All right, so what exactly is COPD? You know, it's not just one disease. It's more like an umbrella term for a few different things that damage your lungs. The word to remember here is obstructive. Basically, it blocks up the airflow and, well, makes it tough to breathe. So, here's the official definition, but let's just pull out the important bits. First, it's chronic. That means it's a long-term thing. It sticks around, and it limits your airflow. But, and this is super important, look at these two words right here, preventable and treatable. That's the key. Even though the damage can be permanent, there's a ton you can do to fight back and slow it down. Okay, so under that COPD umbrella, you've usually got a mix of two main problems. And the best way to think about them is with a couple of simple analogies. First, you have chronic bronchitis. Think of this as a plumbing issue, like clogged pipes. Your airways get all swollen and gunked up with mucus, and that pipe for the air just gets narrower and narrower. Then there's emphysema. This is more like having damaged balloons. The little air sacs in your lungs, they get all stretched out and floppy. They lose that springiness they need to push the old air out. So whether you've got the clogged pipes or the damaged balloons or both, it all leads to this one major problem: air trapping. It's exactly what it sounds like. Air gets stuck inside your lungs. You can't breathe out all the way. Your lungs are kind of stuck being too full of old air, which you can imagine doesn't leave much room for the new, fresh air you need. Okay, so if this thing is so quiet, how do you even know you have it? Well, your lungs do send out warning signs. The trick is actually listening to them, because it's way too easy to just ignore them or blame them on something else. And a lot of these symptoms probably sound pretty familiar. You know, a cough that just won't go away, bringing up some gunk, feeling breathless. The real danger here is how normal they can seem. That cough? Oh, it's just a smoker's cough. Getting winded walking up a hill? I'm just out of shape. But here's the thing. When this stuff sticks around, it's not normal. It's your body trying to tell you something's wrong. And this is how that breathlessness just sneaks up on you over the years. Maybe in your 40s, you just write it off as a smoker's cough and only feel it when you're, really exercising hard. Then you hit your 50s and suddenly just one flight of stairs has you feeling completely gassed. Fast forward to your 60s and all of a sudden, simple things like getting dressed in the morning or walking to the kitchen, they become a major effort. It's just this slow creep that takes over your life. So we know what it is and what it feels like, but what's actually causing it? Let's unmask the culprits behind all this lung damage. Okay, one look at this chart and the biggest piece of the pie is impossible to miss. Smoking. Yeah, about 3/4 of all cases are linked to it. But, and this is really important, it's not the only thing. You see those other slices? Air pollution is a big one. That can be from things like industrial smog or even smoke from cooking fires inside. Then you've got exposure to dust and chemicals at work. And for a small slice of people, it's just down to their genes. And this really gets to that tricky part of the puzzle, right? I mean, we all know that person who smoked their whole life and seems totally fine. And then you hear about someone who never touched a cigarette getting COPD. Why? Well, a lot of it comes down to genetics. For some people, there's a specific rare condition that causes it. For others, it's just their unique genetic makeup makes their lungs more vulnerable to damage. Okay, enough about the problem. Let's talk about the solution. And I want to be really clear here. This is the hopeful part of the story. Because even though COPD is serious, it is not a death sentence. There are absolutely ways to fight back and live a full life. Now, let's be real for a second. The damage that's already done to the lungs, that's permanent. We can't undamage those little air sacs. But what we can do is put the brakes on. Treatment is all about slowing the disease way, way down, managing the symptoms you have, and just making sure your quality of life stays as high as possible. So what does that management strategy look like? It's basically a 5-step plan. Step 1, and this is the big one, is to quit smoking. Seriously, it's the most important thing you can do to stop more damage. Step 2 is medication, usually inhalers that help open up those airways. Step 3 is something called pulmonary rehab, which is a total game changer. It's basically a mix of exercise, education, and support. Step 4 is all about prevention, getting your flu shot, your pneumonia vaccine to avoid those dangerous flare-ups. And then Step 5, for more advanced cases, is oxygen therapy. All right, let's bring this all home. The big idea here is about putting the power back in your hands. It's all about awareness and taking action as early as you possibly can. So if you remember anything from this, let it be these key points. First, COPD is serious, and it creeps up on you silently. Second, that nagging cough or feeling out of breath, it's not normal, so don't ignore it. Third, smoking is the #1 cause, for sure, but it's not the only one. Fourth, finding out if you have it is actually pretty simple. It's just a breathing test. And finally, the sooner you know and the sooner you start managing it, the better your life will be. It's that simple. You know, at the end of the day, your breath is always telling you a story. It communicates with you constantly. The real question is, are you listening? Don't wait for the whispers to turn into shouts. Take a second and think about it. What story is your breath telling you?